we started this study with the notion that CSF neurofilament light is a superior biomarker than serum neurofilament light. And almost like everybody has same notion because we think CSF neurofilament light is the source of serum neurofilament light. Whatever neurofilament light we see in serum is released from CSF. And we think that's the only source of serum neurofilament light. That's why everybody considers CSF neurofilament light as a superior biomarker. But as getting serum is less invasive, people are moving more towards serum, measuring neurofilament light in serum, and trying to adjust for the conformance, what we have did in our first part. But when we tried to predict MS-related disease severity, we found, like it's quite unexpected for us, serum neurofilament light was better biomarker or superior biomarker to predict disease severity or like MS severity. And that we have shown here in our training as well as validation cohort, we have seen same thing. Serum neurofilament light was better to predict MS severity, which is measured by MSSS, ARMSS, or MS-DSS. Serum neurofilament light was better than CSF neurofilament light in our both like training as well as validation cohort. And it was quite surprising for us, like why like serum neurofilament light predicts better disease severity than serum or like than CSF neurofilament light. And we made a hypothesis that it's mainly because of this severity measurements. They have some physical component in it, like or physical activity component in it. It has some cognitive component, but the big chunk is physical activity component. And we think that like change in physical activities is mainly because of spinal cord damage or peripheral neuronal damage. And our hypothesis was that the neurofilament light released from the spinal cord or from peripheral neurons is directly released into the blood or serum via bypassing the CSF. So, and to check our hypothesis, that was our hypothesis. And to check this hypothesis, again, we went back to our first thing, like we ran the linear regression model for CSF versus serum neurofilament light. And we divided the patients into two groups. The first is the patient, the patients, those who have higher serum neurofilament light compared to CSF neurofilament light. And second group of patients, those who have lower serum neurofilament light compared to CSF neurofilament light. And that again, we use the residuals. And the third quartile of residuals, the people, those who have more serum neurofilament light, and the first quartile of the residuals, which have lower serum neurofilament light. And if our hypothesis is right, then the people, those who have more serum neurofilament light, they should have more spinal cord atrophy or spinal cord lesions, or they should have more spinal cord injury-related outcomes, which we have measured by using our by looking at muscle atrophy, bowel movement, bladder movement, and autonomic functions, and so on. And when we tried to check our hypothesis, we found that the patients, those who have more serum neurofilament light, they have elevated spinal cord damage, which we have seen by spinal cord MRI. So these patients have more spinal cord lesions. Also, they have more spinal cord associated clinical outcomes, spinal cord damage associated clinical outcomes. So it proves our hypothesis that. So, and like it will be, the further studies need to be done like to validate our hypothesis. But like at first level, we have proved our hypothesis that the patients, those who have more spinal cord damage or peripheral neuropathy, they release neurofilament light directly into the blood or serum while bypassing the CSF. That's why serum neurofilament light acts as a superior biomarker to look for the factors which are more associated with the spinal cord damage, such as the physical activities or like that's why we have seen in our disease severity models, this serum neurofilament light works superior biomarker than the CSF neurofilament light. And to expand on this, like there should be the studies where people should look for serum versus CSF neurofilament light levels The patients with pure CNS disorders, such as Alzheimer's, and in the patients with PNS disorders, such as Guillain-Barré syndrome or ALS, which are more like PNS disorders. And if our hypothesis is right, the patients with PNS disorder, such as Guillain-Barré syndrome or ALS, they should have more serum neurofilament light in comparison to CSF neurofilament light. On the other hand, the people which has pure CNS disorders, such as Alzheimer's, they should have lower serum neurofilament light compared to the CSF neurofilament light. So further studies need to be done to validate our hypothesis.